The orifice of the womb is so slack that it cannot rightly contract itself to keep in the seed, which is chiefly caused by abortion or hard labor and childbirth, whereby the fibers of the womb are broken in pieces one from another, and the inner orifice of the womb overmuch slackened, was a very old statement gave by Cole and Culpeper in 1658 as one of the definitions of cervical incompetence, and the definition has not changed a lot from what they have said centuries back. Painless uterine contractions and the cervix opening and the baby passing out are what are the absolute tagline of cervical incompetence. One or more late second trimester or early third trimester losses characterized by a rapid, often relatively painless delivery, commonly following the rupture of membranes prior to labor, and in the absence of an obvious precipitating cause, could probably put as definition of cervical incompetence. But then whether it's imprecise, proper, etc., we will see over the course of this particular lecture. The incidence of cervical incompetence is quite indefinite. It is subjective, and very often it's a retrospective diagnosis, and the incidence, if you put into that, varies somewhere between 0.05 to 1% of all the abortions. Variation in the rates of cervical endometriosis would be 0.05 to 3% across the world. And having said that, the incidence of cervical endometriosis have improved in the recent past owing to the improvement in ART centers started to do endometriosis for every pregnant patient who conceives by an IVF. The purpose of the debate here would be out of syllabus in this particular lecture. We will not discuss that. Etiology of cervical incompetence: probably 3 or more terminations or miscarriages, probably using a surgical dilatation of the cervix. Smoking is an important factor for cervical incompetence.